Hi there, this is Dr. Navita Dolopo, and today we're going to start a series on what promotes blood flow to the vagina. I did a video recently called What Turns Women On, and it got a lot of positive feedback. A lot of people messaging me directly, but I did get one particular very nice, classy, matter of fact kind of question on YouTube asking, they thought that the video was clear, direct. It seemed to be from a man, and he wanted to know it's an hour video. I strongly recommend that you watch it. It's 49 minutes on what turns a woman on and 11 minutes on what turns men on. I had already done 2 other videos on scents that arouse men. So far I've been focusing on scents for men. But in that particular video, what turns women on, I was talking more like emotional stuff. So I don't want to repeat the information there, but I believe his name is Pierre. He was asking, what can we do to increase blood flow to the vagina? And besides the emotional stuff, I decided I have a little time, I'll look it up, and I found one particular article on Healthline that I'd like to break down. And believe it or not, when I went on PubMed.gov and some other websites, there wasn't a lot of information, at least so far. I'm still in the preliminary stage. But I got stuck on this particular article, and I'd like to read from it. It is Healthline. I'll put the link in, but if you are just listening, it's /health/women's-health/clitoral-atrophy. And I thought this was very important. Now, I am a doctor of acupuncture and Chinese medicine. I've been a licensed acupuncturist since 1999. I am board certified. I practice here in beautiful Laguna Hills in Southern California in Orange County. And the name of my website is elementsinharmonyacupuncture.com. We have 2 great doctors plus me who work here, Dr. Shodai Omedi and Dr. Hope Lin, and we are here to serve you typically 7 days a week. Now, what I'm going to do is, instead of making a long, like I did last time, hour video, I'm just going to do these little snippets of information to help understand women's health. And I'm also going to start doing a series. The title is going to be funny, How to Prevent Blue Balls, but the series is basically going to be about men's health. It's going to be I'm going to try to keep it funny, to keep your attention up, but it's going to be talking about prostate cancer, how to prevent that, hopefully, and if there's a way to do that. And prostate health is basically what I want to say. And men's health, work hours, self-care. But today we're going to talk about women's health, and the vagina and the clitoris. And I thought this was a very apropos topic. I'm going to wear my glasses. What is clitoral atrophy and how's it treated? So first of all, what is clitoral atrophy? The clitoris is a nub of spongy tissue at the front of the vagina. So I know this is going to be a funny topic for some of you, but this is a serious topic for many women and men, because why is this? I'm going to give my 2 cents throughout this whole article.
1 sec.
Because I help women and men have babies, and I specialize in the most challenging fertility cases. So if there are people, heterosexual couples who are having a hard time conceiving, then we need to understand what's going on in their sexual health. So I mentioned that this is my 24th year in practice, and I didn't always have the guts to just talk about sex and their sexual lifestyle and behavior, but I have found that the more I've done at least 7 libido videos so far, and people are finding them very helpful. The activities that I give people, the activities of, I want you to go on date night. Like today's Thursday, I go on date night with my husband, and you'd be surprised how many couples don't go on date night. They happen whenever it happens. I strongly recommend following Dr. John Gray and reading this book, Venus on Fire, Mars on Ice. And when you come in privately, I will explain why. it is, look at this photo, look at this illustration. And I have women coming in, menopausal, so not everyone's coming here for fertility. They're in premenopause, menopause. I'm 48. I understand what couples are going through. So if you want to keep your health up, that means your sexual health especially. And if you are my client or my patient, you see this book and I fill it out for you. This is a very important book, Healing with Whole Foods. I fill it out for you. Go to elementsinharmonyacupuncture.com, go down to for patients, go to products, click on that. It's basically on Amazon. But if you click on that, it'll take you directly there, and you just don't read it from front to back. I will be filling it out for you, and one of the things I'll definitely be filling out is this section on water. The water is especially the element of the kidneys, and the element of the kidneys has to do a lot with sexual health, especially in regards to fertility, but especially with other things too. But let's just see general symptoms of kidney imbalance. All bone problems, hearing loss, I'm just paraphrasing, head hair problems, any urinary, sexual, and reproductive imbalances. So when we're talking hormones, like Dr. John Gray talks about in his book, we want to understand, okay, what's going on. So I'm going to give my 2 cents throughout this article, and I hope you learn some. I hope it's going to be very helpful if you're a woman, if you're in any kind of relationship, a heterosexual or a homosexual relationship. There's a purpose for every part of your body. And so if there's an article from Healthline saying, what is clitoral atrophy? Why should we learn about this? Recent research reveals that much of the clitoris is internal, having 4-inch roots that reach into the vagina. When sexually aroused, it fills with blood, and the bundle of nerves in the tissue becomes sensitive to touch. So let's talk about that really fast. So I talked about the energy of the kidneys in Chinese medicine having to deal with sexual function. Now, there may be other organs. I'm not going to discuss that. But in my practice, I especially work on strengthening the kidneys and helping women conceive, and having men have strong, high-quality sperm, morphology, motility, mobility. If you go to elementsinharmonyacupuncture.com and you go to, you'll see one of the sections is fertility, pregnancy, and birth. One of the videos I did most recently is motility, sperm motility, and I shared how the sperm of this gentleman went from 2% to 42% with 20 treatments, and in a course of 2 months. So you can watch that. So when I talk about kidneys, now in some books, and I think the consensus for most neurological issues in Chinese medicine has to do with, I had read it being from the wood element, the liver, the energy of the liver. You're going to hear me say organs, but I'm going to be specifically talking about the energy. I personally, professionally, like to really focus on the kidneys, the water element when it comes to any kind of central nervous system, peripheral nervous system, because the brain in Chinese medicine, I was always taught, comes the spine, the neurological system comes from the kidneys. So in some recent texts or some texts I've been seeing that it has to do with the liver. But I personally like to really work on the kidneys. All right. I'm going to keep this basic. I don't want to go too far deep into Chinese medicine. Clitoral atrophy occurs when the clitoris stops responding to sexual arousal and no longer functions as it should. Oh, that's so sad. The clitoris can even disappear. I was so surprised when I read that. This may be the result of a change in hormones or inadequate blood flow to the vagina and clitoris. So the question from Pierre was, what can we do to increase blood flow to the vagina? I can tell you, I've been in practice since 1999. There are women who come in for a variety of health issues, whether they're young, before they just started, they're young ladies, they're in their teenage years, all the way to, let's just keep it just right postmenopausal. Doesn't even have to go into our 70s, 80s, and over. We're just going to talk about women, especially from their 20s to their 60s, because these are working women typically. These are women raising families or having some strong, this is where a lot of our prime years are. And so if a woman has no more sexual arousal, in my book, I won't speak for all acupuncturists, all doctors of Eastern medicine, but I will say in my book, if a woman comes in and she is very low libido, how do I get her libido from a 2 on a scale of 1 to 10 to a 10? Because I want to get her pregnant. Or she's not sexually, she's not trying to have a baby, but I still want her to have a high libido, because her libido is a reflection of her health. Her period is a reflection of her health. A bunch of other things are a reflection of her health. Her libido and her sexual arousal, her ability, her desire for sex is her report card to me. So when I read this, responding to sexual arousal, if there's no sexual arousal and the clitoris stops responding to sexual arousal, she's no longer, interested, then that tells me that the energy of the kidneys is not where I want it to be. Does that make sense so far? If it doesn't, we will talk about this privately. Okay, we talked about it. The clitoris can even disappear. This may be we talked about that. A major shift in hormones, such as menopause or starting hormonal birth control, may be another cause. So if you're starting hormonal birth control, or if you're going to menopause, there may be that drop of sexual arousal, lack of being interested in sexual activity. Clitoral atrophy is less common than vaginal atrophy. I didn't know that. That condition occurs when a drop in estrogen causes the vaginal tissues to become dry, thin, and inflamed. It's common with menopause. So that's also something that I work on here, and I've seen great results over the last 23 years. This is my 24th year in practice, where women will say, oh my gosh, Anna, I have a strong libido. I get text messages from women who are in fertile age because they are working on having a baby, and they say my libido is a 5, my libido is a 7, my libido is a 9, my libido is a 10, my libido is a 2. So it tells me how I need to treat them. So if you're a fertility client and I say text me every day and I want to know where your libido is, it's because I need to know how you're doing every day and what I can do to facilitate in creating the strong libido. Because without a strong libido, you're just doing the, having sex with, my saying here is have sex to have fun, not to get it done. If you're just having sex and it's just to make a baby, you're missing the point. You're not going to have a really good, I just want to make sure you're not going to have a really good, you're not going to have a very effective sexual practice in order to create a baby. So loss of sensation is a serious sexual issue. The clitoris is often considered a key to female orgasm. The nerves in the clitoris can produce intense sensations during sexual activity. Read on to learn more about the symptoms of clitoral atrophy, as well as what can be done to help restore sensation and sexual function. So this is a pretty long article. I just want to touch on some things, but I will share that acupuncture and herbs can help tremendously just from what I'm reading. Unfortunately, when I looked up on pubmed.gov, clitoral atrophy and acupuncture, there was nothing. So I'm going to have to start doing my own experimental studies here. But I can tell you, the women here, I'm working on their fertility, I'm working on their libido, and they said, whatever you did last time, my libido was super high. Or ever since I started doing acupuncture, my libido has been extremely high. Testosterone levels, however, fall as menopause nears. They may also decrease when starting birth control or estrogen supplements. Those who have a full hysterectomy may experience clitoral atrophy because the ovaries are responsible for producing both estrogen and testosterone. Removing them could lead to a loss of testosterone. Ultimately, this could cause clitoral atrophy. The loss of estrogen following a hysterectomy could also lead to vaginal atrophy. So if you're going to be doing acupuncture specifically for increasing libido, increasing sensation in the vaginal area, I strongly recommend for at least 2, if not 4 to 8 weeks, coming in twice a week. And if by the 5th to 15th treatment, you're not at least 50 to 90+% improvement, that's when you want to go on herbs. Other acupuncturists, other doctors of Eastern medicine may have a different recommendation, but this is what I do here, and we get really great results. When to seek help. Sexual health is important for your overall health. Clitoral atrophy may be an overlooked but serious cause of female sexual dysfunction. If you're experiencing sexual issues, talk with your doctor. And let's see. So again, read this article. There's no single, how is it diagnosed? There's no single test or physical exam that can definitely diagnose clitoral atrophy. Maybe that's why there's no study on it. Instead, doctors may rely on a physical exam, your reported symptoms, and other tests to reach a diagnosis. Doctors don't always inspect the clitoris and clitoral hood during a routine physical, such as a yearly pelvic exam. So during your appointment, your doctor may want to do a physical exam of your clitoris and possibly your vagina. Blood tests are also useful in checking hormone levels and determine if your testosterone is below normal. So let's talk about that. So if, let's say, someone's working with me, and I'll say work with me for at least 3 months and do acupuncture twice a week and do herbs as well. If you're already seeing really good results, say they're sexually active and they find their arousal much greater, then I'm going to hold off on the herbs a bit. But if they're like, look, it's 10 treatments and I'm not really where I want to be, I will then prescribe herbs. And then I'm just going to, your reported responses to the acupuncture and herbs tells me, you know, how we're progressing. If it's not really going the way I want it to go, or just to, you know, see what's going on, I will say give it at least 3 to 6 months and then go back, do some blood tests, and let's see where you are with your hormones. Does that make sense? So again, we'll talk about this privately when you come in, but acupuncture can be a lot of hurry up and wait. Let's do a lot of acupuncture and let's see what happens after 5, 10, 15 treatments. Typically what I see in that time frame is people getting, in general, I don't care if it's neck pain, digestive issues, or in this case we're talking about sexual arousal, arousal of the clitoris. It sounds from this, when we go further into this article, that there are things that we can do to revive the clitoris. The style I do is called Dr. Tan's Balance Method. And when I treat men for erectile dysfunction, I'm not putting the needles in the penis. My husband will say, where do you put the needles? I'm like, I don't put the needles where you think I do. I put the needles everywhere else. I might go from the elbows down, the knees down, especially around the ankles, especially around the ankles and the wrists, some on the head, and there might be some on the abdomen, but that's not as frequent. So let's see. If you regain some sensation, the treatment may continue. If you don't have any response to the treatment, so this is whatever the treatment is from a Western medical. If you don't have any response to treatment, you and your doctor can begin looking for other potential causes. So they're talking from a Western medical perspective. I'm bringing up what I would do as a Chinese medical doctor. So treatment options. Treatment depends on what your doctor thinks may be responsible for the loss of sensation in the first place. Here are some of the most common treatments. This is why I wanted to bring this up in this video. Have sex. Regular sexual activity can help your clitoris stay healthy and sensitive. It may restore the feeling in the sensitive nub too. So let me deviate a little bit. If you go to elementsinharmonyacupuncture.com and you go to fertility, pregnancy, birth, you scroll down, you'll see a lot of information and you see sperm. Go to that video. I read from babyhopes.com/blogs/fertility/abstaining, and these are scientifically cited from PubMed. And so I'll let you go there. One thing that shows is that studies show abstinence is merely irrelevant for couples with normal fertility. So I want to make it very clear. If you go to Mayo Clinic, if you go to the National Institutes of Health, a third of the health issues of fertility issues is a woman, a third of the fertility issues is the man, and a third of the issues for infertility issues is both. That's why I want husband and wife here, so I can treat you both. Or if you're lesbians, I want mommy and supporting mommy to come also, and I explain why in person. So This is reiterating the information from that blog, which is science-based, research-based. Basically, have sex. No abstaining. Number 2, get moving. You can also help increase blood flow with regular cardio exercise. Cardio exercise helps boost blood flow throughout the body. What's good for the body is good for the clitoris and vagina. Regular exercise can also keep testosterone levels from dipping. I want to also make it very clear, acupuncture increases blood flow to the clitoral area. Acupuncture increases blood flow to the vaginal area. Same thing with the penis, okay? So again, if within 5, 10, 15 plus treatments, you're not seeing the results, then we'll do herbs. Does acupuncture and Chinese medicine have a high, 100% success rate? No, and neither does Western medicine. But it's worth trying to understand. The beginning phase for easy cases is the first 10 treatments. The beginning phase for chronic issues is the first 20 treatments. So if you just understand that, okay, this may take a while, be aggressive, 2 or more treatments a week. For the first, ideally, 4 to 8 weeks, minimum 2 to 6 weeks. If you're being aggressive, you will see results sooner than later. All right, so we talked about get moving, cardio, acupuncture. I want to put my 2 cents in. Acupuncture and herbs will increase blood flow to your vaginal area. Try testosterone replacements. So this is talking about testosterone supplements as cream, pill, or injection. Definitely see your doctor if you want to do that, if you're a Western medical doctor. If you want to do something from a Chinese medical perspective, we're here to support you. Talking to your partner. Oh, I'll let you go through this on your own. Be frank, volunteer new ideas, keep an open line of communication, take the focus off orgasm. I do have conversations here of women who are very upset that they're not having an orgasm. I'll just leave it at that. That's why I'm doing this video. I'll just leave it at that. But if hopefully I'm going to be doing more videos, but as you can see, this is already a 22-minute video just on this one article. The last video was pretty long. I want to do these in little spurts, okay? Maybe the next video we'll be talking about men and erectile dysfunction or prostate health or other things too. I want to, kind of keep it even. Right now we're talking about women again. Outlook. Clitoral atrophy may be one of the most underreported sexual health issues. That's this video. Treatment is possible though. That's why it's important to talk with a doctor or healthcare provider when you first begin noticing symptoms. Whether or not your symptoms are caused by lack of blood flow or low testosterone, a doctor can help you identify the underlying cause and find a solution that works best for you. So, look at this. Next article, The Ultimate Guide to Clitoral Stimulation. I will have you go to this article yourself because I've got to get going, but I'll just read. The URL is healthline.com/health/healthy-sex/clitoris. Wow, I'll just read the top things. First things first, what is the clit? Talks about the clit is a nerve dense body part responsible for many a orgasm. Where is the clit exactly? I'm paraphrasing this whole thing. The most common answer to the question is the clit is the P-shaped structure at the apex of the 2 labia. There's a lot of information, but I'm just going to read what you need to know in this video. So recap clitoral anatomy 101, and it goes through all that information which you don't need to know here. There's some pictures of the vulva and the clitoris, and the G-spot versus the clitoris, are they the same? The G-spot is often described as a nerve-dense erogenous zone about 2 to 3 inches inside the vaginal canal along the front wall. Well, some research suggests that rather than being a totally different entity from the clit, the G-spot is actually the place where the clit's bulbs form the heart shape that hugs the canal, meaning the G-spot is a specific portion of the clit that can be stimulated internally. And this is in quotes. Vaginal penetration can feel great for the sensations it provides not only inside the vaginal walls, but also for the pressure it can put on the interior parts of the clitoris, says L.Ac. Some people find that a combination of penetration and external clitoral stimulation can result in intense and intense orgasms. Now, I said earlier that there's some patients coming in, they're upset because they're not able to have an orgasm, they want to have babies, they're feeling like they're, giving energy to the husband or their partner, but they're not feeling stimulated. That's why I'm doing this video. What did I say earlier? Strengthening the kidneys has to do with fertility, and it also has to do with central nervous system, peripheral nervous system in my book. Now, there might be some other Chinese medical textbook that say otherwise, but this is what I find to be very helpful. The energy of the liver, the meridians go around the genitals, goes into the genitals. There's mother and son anyways in this thing that we call the 5-phase or the 5-element cycle. So, clinically speaking, we work on both the kidneys and the liver. But I just want to share my 2 cents that when I'm working on sexual, improvements, I'm working on those organ systems. The energy of the kidneys, especially because I want their libido to be high, and also the liver, because I want the liver to feel relaxed. The energy of the liver, I keep saying energy. I'm not talking about the actual liver. I'm talking about the energy of the liver. The energy of the liver tends to get stagnant. We get irritable, angry, stressed, resentment, pent-up emotions, controlling emotions, depression, all that. And if those are the emotions, because every organ system in Chinese medicine has an emotion, if those are the emotions of the liver, and the liver meridian goes to the genitals as well as the breast and other parts of the body, what's going on with the liver? It gets angry. A lot of angry women come in here. And divorced women, angry women, they're still holding on to resentment from their ex. They're still holding on to the abuse. They're still, it hurts. And so that's not healthy, especially since the energy of the liver goes to the genitals and the breasts. So I'm going to end this video because it's my husband giving me a call. It is date night. He's wanting to know all kinds of information about when I'm going to go to the movies. So this article, I'm going to talk about it more next time, exactly how to stimulate the clitoris. There's going to be a lot of great information that we're going to talk about. That'll be the next video. But we will, have more conversations about this. I think this is a great, just a great start to talking about women, our, genitals, and the importance of sexual health. And given that my husband just gave me a call, I want to make it clear to you, because I'm sending this especially to my fertility clients. You got to have date night. And just having date night increases blood flow to the vagina, because it's all about you guys. You got to be dressed up. You got to have fun and keep your relationships fresh. And if you're irritable or angry with your husband and it's just not going in the right direction, you might want to do some therapy. Or listen to my Happy Club videos and consider doing a lot more activities together. But you got to work on this, you got to work on your communication skills. And communication doesn't always mean talking. It can mean, other types of extracurricular activities. Men aren't always talkers. All right, so I do recommend my friend Todd Krieger. He's a psychologist here. He specializes in sexual health issues. But there are all kinds of sexual therapists that can help you. That's not my specialty. I just happen to treat people with some fertility issues and have some sexual problems. And that's not good, because it tells me you have some issues with the energy of your kidneys. All right, have a great night. Thank you so much for watching. Take care. Bye-bye.